Well, we've recommended that you have a heart catheterization or an angiogram on your heart, so I wanted to explain how that happens. Nowadays, we bring you to the cath lab, we give you sedation, we like you to be very relaxed during this procedure. 90% of the time, we're able to go through your wrist. So we'll prep your wrist for the procedure, but we'll also prep your leg in case we can't use your wrist. What we do then is we numb your wrist, enter it with a small catheter. We run that catheter up to your heart. It's basically a hollow tube, and we inject iodine into the bloodstream of your heart. We want to see our nice, smooth coronary arteries. What we're worried about seeing are areas that look like hourglass where cholesterol has built up inside the artery. If we see a significantly blocked artery, particularly if it looks like it's active or if it corresponds to your stress test, we usually recommend doing an angioplasty and or a stent. In that case, we thread a small wire into the coronary artery, followed by a very small balloon, followed by a balloon with wire mesh on it that we open up inside the plaque. When we take the balloon and wire out, the mesh stays in there like a conduit to hold the artery open. That's what a stent is. So when you've heard of a friend having a stent, that's what they're talking about. That whole procedure takes about an hour, even if we have to put a stent in, and you're sedated during the whole time. The risk of the procedure, including if you need a stent, is a 1 in 1,000 risk of something catastrophic happening. Death, stroke, loss of limb, loss of kidney function, something horrible, 1 per 1,000. There's a 1 in 100 risk of getting a complication at the vascular access site, like in your wrist, or if we have to go through your leg. The most common one is simply a large bruise called a hematoma. There's also a 1 in 100 risk of needing emergency heart surgery. And that usually occurs in the scenario where we try to open an artery and it doesn't behave. Either the artery won't open, or the stent won't open, or the artery suddenly shuts down. 1 time out of 100, you have to go right to the operating room. Having said all that scary stuff, most people go home the same day that they have a heart cath, even if they have a stent. After we're done, we pull all that out of your wrist or your leg. We watch it for a few hours. If everything's going well, we let you go home. So that's the general idea behind a heart catheterization or an angiogram.